Estás viendo Canal América, televisión dominicana para el mundo.
A Time for True Show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Bienvenido al Tiempo para la Verdad. Yo soy tu host por la noche, el Dr. Bernard Fialkoff. Y como siempre es un placer compartir con mis televidentes, mis amigos, compañeros de este mundo, la tierra, esta bola nuestra que hay que proteger. Y en este show vamos a hablar con una conferencia a donde me invitaron a hablar sobre el vaping, las drogas ilícitas, el colegio de los cirujanos dentistas de Puerto Rico, debajo del presidente Raúl Ortiz, la presidenta electa Yvette Rodríguez y sus ejecutivos. Me invitaron a hablar y estuve ahí. Y ahí educamos a mis colegas, los dentistas, sobre este flagelo que está afectando tanta de nuestra sociedad. En este programa te voy a dejar ver la presentación que yo hice. Además de las drogas, también del poder del ser humano, el poder de la emoción, el poder de la comunicación, algo que se ha probado con resultados científicos que pasaron durante el COVID, que el distanciamiento social causó muchas enfermedades. ¿Por qué? Porque no había humanidad, no había cariño, no había comunicación con afinidad. Estos teléfonos, aunque son increíbles, no toman la posición en la vida de lo más importante. Nosotros somos, y entonces vamos a empezar con el programa en San Juan de la Conferencia de Cirujanos Dentales de Puerto Rico. Aquí empezamos. Why are we here as dentists? I mean, we're dentists. We do teeth. Okay, we do gums. Okay, we do dental fixtures, but we're dentists. So why are we going to bother to talk about this? Well, we're also fathers, mothers, aunts, uncles, sisters, brothers. And last year in the United States alone, actually in 2021, we lost 107,000 Americans to drugs. Now, I want to give you a comparison. 10 years, Vietnam War. Who wants to tell me how many Americans died? 55,000. You get 8 plus. 10 years. Now, what happens with 55,000 if you double it? You get what we got in 1 year with drugs. But I don't see anybody protesting on the streets like they did for Vietnam. That's 1 year versus 10, and we doubled. Why aren't they protesting? Is it possible that the drugs are already having an effect on the society and they've already been dumbed down and put to sleep? I see you're quiet. I'm going to elicit your reactions, and when I speak, I really want to interact with you. I don't feel I'm any better or different than you are. My philosophy is that unless we work together, we're all going to not have staff in our offices because they'll be high on drugs. When people are high on drugs, are they producing? No. Do they show up to your job on time? No. Do they seem really wonderful, and the next day you go, what happened to that wonderful person I met yesterday? Now you have the answer to what's going on. And if you have any nephews or nieces or have friends who have little kids, we're responsible for their environment. It's very quiet again. I know I got to you. That's what I want to do. I want to get to you. I'd like you all to go out of here invigorated that you're going to do something. And that you're going to, at least in your office, educate these people on vaping, drugs, and I will tell you more about it. So in 2022, you say, well, it's getting better now. It's getting better because we're legalizing. It went up to 109,000. So now as dentists, we know that if we're doing something and it's not getting better, do we continue to do the same process? That's a question. Anybody can answer. No, we don't, because we base it on science. So let's go on. Vaping has become such a dilemma that the FDA, the CDC said, what is going on? How are we losing youth to vaping? All they're doing is vaping a flavoring. How can they be dying? But they found this happening across the country. We're not talking about somebody 70, 80, 60. We're talking about teenagers. We're talking them ending up in the ICU of hospitals across the country. And so you would think if that was happening, and we saw the drugs were increasingly causing death, which is a health crisis, and it was doubling the rate of a Vietnam War, not in 10 years, but in 1 year, that means actually if we doubled 2 by 10, that means 20 times. That means that we're losing 20 times the amount of people without war from drugs that we did in the war. That was protested worldwide as an atrocity. And you say, well, Dr. Fialkoff, this is dentistry. Yes, this is dentistry, one of the last professions that's standing for patient rights, that wants to do the right thing regardless of the coverage, that works difficult. You guys are amazing out there. This video is going out to the world, so I'll say something to the world. Your dentists are wonderful people because we try really hard. We really care as dentists as a profession. And so you would think in our offices, if we do the wrong procedure, we change. We complain to the company. We tell the researcher, you know, this is not working. Let's do a different bone graft. Let's do a different membrane. I'm a surgeon, I'm sorry. Let's put a different implant system. I don't want any more peri-implantitis. For those of you who are lay people, that means your implant's dying, falling out. So what happens is you would think that we would stop what we were doing, but look at what's been happening in Colorado. They legalized psychedelic drugs. That was a movie, Cheech and Chong, when I was in high school, you know. Hey, oh yeah. But that was then, I guess we had some rationality. Now what we do is we legalize it. That's what Colorado did. Why did they legalize it? Because this man, Matthews, an advocate in Colorado, said, you know, we have very poor mental health in Colorado, so we need a solution. I guess in dentistry, I guess if we saw that people were losing their teeth, I guess I would come out and say, well, we need to take more teeth out. And because, you know, we're losing teeth, so we're going to take more teeth out, you know. I know it seems ludicrous, but some of these things I see are ludicrous, but yet very little is being said. And you would think, well, that's only Colorado. That's out in the middle of nowhere. Yeah, I mean, that's good skiing, but what else do you have in Colorado except the mountains, you know? But look what they did in California. They passed the same bill. They legalized psychedelic drugs and mushrooms and LSD. Unbelievable. And the senator there said that was occurring. Why? Because he said there was a failed war on drugs. But can I ask you a question? And if your patients came in and you never educated them how to brush and floss, would they know how to prevent caries? Anybody could answer. No. Would they prevent periodontal disease if they weren't flossing? No. Would we just have them go on eating sugar? No. Because as professionals, we would do something that was efficacious. Yet here we are losing people to drugs, and what we're doing is we're increasing the drugs. And what's missing? Education. Where is the education? What failed war on anything? Why is dentistry so wonderful? Because we've almost put ourselves out of existence. When I was in dental school, they had this enzyme, sialin. It was going to eliminate caries. And I said, well, why did I go to dental school? But it didn't really happen. And there was enough left to treat. And we still have so much to treat. And dentistry is advanced. So now we have cosmetics and Invisalign and veneers and unbelievable what we've advanced. But back then there was going to be no dentistry. Why? Because we educated. We did things that were efficacious. We're good people, which is why I'm talking to you. Now, what did the United Nations conclude in 2016? World leaders, presidents, ambassadors, doctors, public health officials, education. So why aren't we listening to the United Nations Consensus UNGAS Convention 2016? So let's take a look now, and let's start getting very scientific about vaping. Vaping has a media that carries the flavoring. That media is either vegetable glycerin or propylene glycol. Who knows what propylene glycol is? Louder. Antifreeze. Now you're saying, no, Dr. Fialkoff, you're making this up. Okay, you don't need it here, but in Puerto Rico, your kids vaping, some of them are vaping antifreeze, propylene glycol. That is one of the media that carries the flavorings. Remember what I told you, this is not my personal opinion. This is scientific. Now, the vegetable glycerin and the propylene glycol cause xerostomia. As dentists, we know if we get xerostomia, we're going to get caries and periodontal disease. We're going to get failure of our crowns from submarginal caries. I don't want to go over what you already know, so I want to be very quick with what we know as dentists and hit what's so important. How many of you, raise your hands, have kids? Okay. How many of you have nieces and nephews? Okay. How many of you have friends who have kids? I got you. Okay, good. All right. I'm not going to be serious, but I'm going to be very emotional. I'm a Cuban guy, and I really like America. When I lost my country, Cuba, I was very lucky that I had America. And Puerto Rico also, because we have America. Even though we got to figure out how we get them to make us a state, maybe, or I don't know, or independent state. But whatever, we're very lucky we have America, because it does stand for freedom. It's not perfect, but I don't know any family doesn't fight, so I don't know how we should expect the country to be any better. It'd be impossible. It's composed of families, and families fight over food even. I don't want to eat there. I want the Italian. No, I want to go to the Chinese place. What movie? No, that's action. I want drama, romance. So, okay. So that's the media. Now let's go to the next thing. Now we're going to talk about the flavoring. And a young person says to you, oh, come on, Dr. Smith, Dr. Goldberg. I'm just doing the flavoring. I mean, I know you're a doctor, but you're from a different generation. You look like you're about 60, 70. Come on, you got to come up to present time. We're very smart in the new generation, very savvy technologically. But guess what? They don't know what they're talking about. The flavoring by itself, which is called diacetyl chemically, causes popcorn lung. Bronchiolitis obliterans is the scientific names. It obliterates your bronchial passages, which is why these young people end up in the ICU, and some of them die because they can't breathe. And the kids love to make different forms with a cloud, right? You see different, like Mickey Mouse and Donald Duck, and they're unbelievable what they make with those vapes. So imagine how much they're taking into their lungs, which is why they die. It's called popcorn lung because it obliterates their lungs like popcorn. Now, that's diacetyl. Now let's talk about what the heating element is made of. Now, heating element, again, it's going to be plastic or metal? Well, it's going to be metal because otherwise it's going to melt. Now, why am I saying that to you? Well, because there's been no regulation of the metal that's being used in vapes. So guess what toxic materials are in those vapes? Lead, That's really good for you. We eliminated from paint, so we got to put it somewhere. Like aluminum cans. We had too much aluminum, so after World War, so we made aluminum cans. It was really good for the health of aluminum. So now we have too much lead, so I guess we eliminate from paint. We'll put it in vapes. I'm going to try and make it facetious, humorous, and all at one time. And nickel, that's really good. Nickel. We were concerned about it with a guy in the laboratory with a partial dentures. He's going to bring in nickel, but it's probably good for kids, though. It's okay. It's kids, so they're younger. So the nickel's no problem. Just the lab techs, because they work for us. And, and then arsenic. But arsenic is good. The witches used to use it, and if you dig them up, they still look alive. Actually, I want you to know, if you use a little bit of arsenic, it actually doesn't kill you. It stimulates you. I don't want to tell people because I don't know what would happen. I'm afraid. And, next thing we know, we're going to have arsenic out in the society because you do a little bit, and then some nut will mix it with fentanyl, and we'll have another crisis. But yes, a little bit of arsenic. By the way, a little drug stimulates you, a little bit more puts you to sleep, a little bit more, Keith Ledger, you're gone. That's a cycle of every drug. That's a cycle of sugar too. Any of you who have a problem with sugar, it's because the body's addicted. So don't think there's something wrong with you or that I just like sugar, I can't stop. No, it's because you're addicted to the sugar. It's a drug. Anything the body gets addicted to goes the same cycle. A little bit stimulates you, a little chocolate, a little bit more, you go to sleep. A little bit more, you probably get sick to your stomach. You don't die. You have to eat too much chocolate. But that's the cycle of any drug. Now, why do I tell you this about the metal is this. There's another flavoring that's cotton candy. And here you see the name is called ethyl maltol. Guess what that is? That's a heavy metal transfer agent. Well, that's really good because now we have those heavy metals on the metal. So I guess the next thing we should do is put something that's going to transport it faster into the cells. I like the quiet. Yes, that's good. Okay, yeah, it's amazing. I know if we're in New York and I had a study club and this was about amalgam restoration materials, we'd be killing each other because as dentists, we really care. No, don't use that one, and that has too much mercury, and use this one, and that bonding agent is, I can't say the word, it's no good. Use this bonding agent. I don't use that bonding agent. I use this. Right? That's what we do. Dentists love that. We really care. But who's doing this about this? I guess we've got to get dentists to do this, and then we'll really care. So this is from Johns Hopkins University. Okay, let's go on. Remember that all I've told you so far is the liquid media, the flavoring, and the metal. I didn't even add anything yet. I already killed a lot of kids and didn't even add anything. I'm sorry if I sound like I'm a public health official, but I feel that as a doctor, I got to do something. We lost Cuba. Why? Because people didn't realize, right? We lost Venezuela. Why? Because people didn't realize. So I'm going to ask you a question I want to answer. If people are getting drugged in every country, are they going to realize? No. If they don't realize, what can happen to their country? Louder? They're going to lose it. I don't think that guy out there who's really smart with the white hair, I don't think you'd like to be told what to do, right? I didn't think so. You don't look like that kind of guy. You could make it good in New York. And you might be, are you from New York?
No, but my son's in the Sunset Park in Brooklyn.
Okay, there you go. All right. There you go. Now, I want to ask you a question because I like to do a lot of things in one shot. Do you have less energy now or more than when you walked in? Raise your hands if you think you have more now. Raise your hands if you think you have less. Good. Scientific study, because these are doctors who did the study. It was done with control study. My friend Christian did it. We have more energy. I'm not going to ask you like how you have more energy, because there shouldn't be, because you didn't eat anything. So I don't know. I don't think, just because in COVID we found out that the social distancing caused disease, we don't have to look at that either. I mean, social distancing was for disease. So, just being human beings, talking to each other, that's not important. We can just be on the phones all day long and not talk. I won't speak to Christian. It has no effect. But you see now that it does. This will be horrible when you walk out of here. You won't know what to do with yourself. Because you're going to say, boy, I got to be friendlier. I can't just be on my phone all day long. That's what my wife was complaining about when I didn't pay attention to her. I thought she was like being a pain in the rear. Okay. Now you see how we come alive? I want your interaction. Come on. This is for the world. Remember, we're being videotaped. This is for the world. They have to understand that they have to talk to each other. If they talk to each other, is it possible they may show up for your office on time? If they feel better? Probably they would, right? And if they had more energy, could they work more? Yeah. If they worked more, would they make more money? Yeah. Good. If they made more money, could they pay your bills? Yeah. Good. You have to not to worry about your billing agent saying, "Hi, Dr. Gonzalez, nobody wants to pay." And for those politicians who are watching this video, you'd have more revenue. The economy would actually go up. But all we'd have to do is talk more to each other. We wouldn't have to legalize. I tell you what we would legalize. We'd legalize talking to each other. And we'd make it mandatory. Anyone who doesn't want to laugh, it's okay. In my world, you can laugh, not laugh. You know, you're allowed to do whatever you want. Now, let's go on, because this is a dental lecture, and we can't talk about life. We have to only talk about teeth. You know, so now here. Nicotine. Now we'll add on nicotine. Now, when you vape nicotine, because came out, e-cigarettes were a solution to cigarette smoking. But it hooks you more, because it's heated. And you take it directly into your lung. So you have more nicotine. I mean, the studies haven't come out yet, so I guess we have to wait 10 years till 5 times the cancer rate happens. And so, oh yeah, vaping was really bad. We were right, but we'll wait till all these people die before we do something. Good, I got your attention. Okay, now, nicotine addicts people. But more importantly, who's vaping? Older people or young mostly? Young. What's developing in a young person? Their brain is developing. Here's the scientific part. When you take nicotine, there's a 13 to 25 years of age. Remember, this is not me. This is the CDC and NIH. I'm just making it interesting. Cuban people like to dance and I don't want to be like, yes, in the study of Maras and Morose in 1945, they showed that scientific base and 4,000 literatures. By the time we finish, everybody's dead. And I'm not being facetious because I love researchers. And I'm being serious because if they weren't around, we wouldn't have the solutions we have. Because I don't know how to do it. I'm being serious right now. So don't think that I'm picking on anybody. I just want us to wake up to how much we have. These lights are on because of people, aren't they? These seats are here because of people. This guy's here because he ate at some place this morning. So the people. Okay, let's go on. You already got the message on people. So nicotine. So we have a whole generation coming out. Their brain is irreversibly affected. It doesn't matter that when they get to 30, they stop doing it. They're irreversibly affected. So when you, what's your name? Yeah. Iada. When you become 70 and you have to go to the hospital, who's treating you? They are. Oh my God. Yeah, you didn't realize that. He did over there. He's like close to my age. I'm going to be 70. I'm going to be 70 in June, by the way. June 2nd, I get 70. So, it's, by the way, see, people say, wow, you look good for 70. Good. Do something about the community. Do something about drugs. You look like me. You don't have to look like me, though. You'll be better. You're handsomer. You have more genetics than I do. So you'll look better than me. I'm being serious. I'm also very honest. Next lifetime, I'm coming back a different, because I want to have more genetics behind me. I'm Jewish, guys, so what are you going to do? But it's okay. I get smart genes. Okay, good. So let's go on. What happened? I blew the thing. It doesn't want to work. We got censored. Oh, there we go. Okay. We had censored there for a second. All right. Now, you see how smart you all are? Because in order to laugh, you have to already know what I'm telling you. Otherwise, you think I was insane. But you're all laughing, so it means you already know it. So if you already know it, I'm only going to make you feel really horrible right now, because I don't want to patronize you. Why aren't you doing something about it? I'm going to be mean. I'm going to be like the professor in dental school and give you your test now. This is your test grade. You've got to go back and study, or you better start doing something differently in the clinic, because I don't like the amalgams you've been doing. But they're not amalgams, they're people, and they're all in your office. I'm being rough right now. I won't be nice, because I'm angry. I want somebody to listen. I don't want to wait till after war when all these people walk into wherever they walk into say, oh my God, look at all these, oh my God, oh, they were so good when they were, at the graveside, right? I like to make humor out of it. So I want to ask you a question. Why didn't we do something while they were alive? Now, you see, I brought you down. What happened to the energy level in the room? It went down. You got a little bit annoyed with me. You didn't like it, and the energy level went down. So now I'm going to show you something, because I like people to like me. Cuban people like that. So look at the person next to you and say, you know something? I'm going to do something to help my kids. Go ahead now. Look at the person next to you and say, you know, I'm going to do something to help my kids. Good. Now make believe you're a dental professor. And look at the person next to you and like you're a dental professor in school. I'm going to do something about my kids. Go ahead. Okay, now look at me and say, okay, Dr. Fialkoff, I'm going to do something about my kids. Oh, that's like horrible. Come on, with some energy. Okay, Dr. Fialkoff, I'm going to do something about my kids. Good, another scientific study. Where's the energy level now, lower or higher? Okay, another study on communication. Unbelievable, wow. So if you want to be healthier, I guess we have to communicate more. And if you communicate to more community, that means you have more of their energy for free. You're actually getting their energy for free. And who wants to do better in their office and have more new patients? Give me a break. Come on, be honest. Nobody here with some suit on not answering. Who wants to have more patients in their practice? You don't? Let me have your office then. You're selling it cheap to me? You all do, right? Well, if you had a woman who was saving your kids at the school, wouldn't you elect her the mayor? So ahí tienen los resultados y también pudieron ver lo que hace la comunicación, porque eso fue uno de los puntos que yo quería expresar. ¿Y por qué? Porque mucho de lo que estamos pasando en este mundo es por la destrucción de la humanidad, de la familia, de la comunicación. Y por eso vienen las drogas, la violencia, el crimen, delincuencia. Y entonces debemos aprender y empezar a aplicar comunicación, mantener la familia, mantener la importancia de comunicar con afinidad y con cariño. Y de esa manera, además de mantenernos felices y saludables, podemos extender una vida para el mundo, a nuestra comunidad, a nuestro mundo entero, y acabar esta violencia y todas las cosas que están pasando, las guerras, los problemas económicos. Vamos a darnos cuenta de todo lo que tenemos, todo lo que Dios nos ha dado, y tener un poco más aprecio y admiración por la vida, el milagro de la vida. Muchas gracias por estar con el tiempo para la verdad y te vemos en el próximo segmento. Muy buenas noches.
This show was sponsored by A Time for Truth Foundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your feet